So I know I talk a lot about myself, but Dr. Lil, I think it's time we shift over to you
Oh
because
boy.
so many people, they see me talk about you on TikTok, on all my socials, and I keep telling everyone how great you are.
Thank you.
So why don't we get to know a little bit about Dr. Lil
I'm a
and
little shy about that.
take us back to a time period that you feel is comfortable for you.
My life took a lot of twists and turns. That's for
Okay.
sure. I didn't know I was going to be who I am today. It wasn't, planned. You know how some people know, I'm going to be a doctor, I'm going to be a teacher, I'm going to be this, I'm going to be that. I knew as a kid, I was always very empathetic. I had a sick mother, physically sick, emotionally sick, mentally sick. So I grew up in an environment where I was always a caretaker, always had to be careful what I said, always had to be careful what I did. So I kind of grew up on pins and needles a little bit, you know. But I also knew I was really smart. And the one thing that even though my mother wasn't well, because of my Asian background, she always put a big focus on, you got to go to school, you got to be smart, you got to be a doctor, you got to do this. So, did I want to go to medical school? I had an interest in medical school because, I loved medicine. I loved helping people. But it wasn't like I woke up, I want to be a doctor. And then I loved animals. I loved nature. And I think part of that was my coping mechanism, just growing up in a sad childhood. So I kind of loved nature. I would spend time with the spiders and the birds. Right. So I'm like, oh, maybe I'll be a vet. But then when you saw sick animals and dying squirrels, I couldn't do it. My heart couldn't do it. I always liked educating. So my mother would tell me stories about how, as a kid, I would put a little blackboard up and I'd have all my stuffed animals. Those were my students, and I'd pick on my stuffed animals. So she's like, you really should be a teacher. So I was trying to figure out, well, how can I combine all of this together? Being a teacher, love of nature, love of medical and things like that. So when I went to school, I became a biology major, secondary education, pre-med, because I wanted to see, well, where was this going to go? Maybe I'm going to love it so much, I'm going to go into medical school. Right. So once I got into school and I did my biology degree, during my sophomore year, my mother was diagnosed with cancer, and it was terminal. And it was hard. It was hard seeing her going through what she had to go through. So my career choice was just all about, let me just get out of school. Let me just get some sort of job. Right. Because it was very difficult for me to stay at home to see her suffering so much. And there wasn't too much I could do except for the fact that part of her disease, because it was lung cancer, because of the radiation therapy, it destroyed the esophagus. And she ended up on a permanent tube feeding. So that was my first introduction to nutrition, really. Wow. As an Asian, we were always, eating healthy and things like that and very holistic, but really seeing how good, proper nutrition can help somebody that has a disease. Right. So even though the doctors pretty much wrote her off and said, yeah, we're going to give her like 3 or 4 months, no, she went into remission. Wow. And that was because we learned how to do home tube feeding. So my mother could never eat again. She could never swallow anything again because the radiation destroyed her esophagus. If she said, hey, I really feel like lobster. Okay, let's make you some lobster, Mom. And we'd make it into a soup and we'd do a tube feeding bolus. Wow. Oh, I really feel like a Dunkin' Donut. Oh, okay, Mom, we'll go get you a Dunkin' Donut. Right. So she actually went to remission for a couple of years. Unfortunately, the cancer was so aggressive, it eventually came back and took her life. But what happened with me in my career is that because she was so sick, I couldn't go on for my master's. I couldn't go on to medical school. I couldn't go on to any of those things. Right. So what I did was when I graduated, I said, I need to get a job. So I got a job at a lab and became a lab tech. Wow. So I was still in the sciences and I was still, it was still semi-medical, wasn't nutrition. But I was able to at least make a living, try to start a little bit of my life, become independent. And then when my mother passed away and I actually had to move because I didn't want to be in New York anymore, I moved to Florida. I knew, hey, you know what? I want to do something else. Great, lab tech is fun, but I want to be with people. I want to help people. I don't want to just play with test tubes and, right. I wanted more. So after I healed emotionally from the trauma of seeing someone that you love die, because I was young. I was in my 20s,
Right.
a girl in her 20s losing her mother. That was
Yeah.
hard. It was
Yeah.
really hard. So moved to Florida, was trying to figure out, what should I do? What should I do? I really like nutrition. So got into nutrition, was going for a master's degree. And I was just trying to figure out, how do I do this? I have to work. I have to make a living, but I want to go back to school. So it was, it was tough, like it is for most people. But we figured out a way, and I did it and got my master's in nutrition. And during one of my internship rotations, I internship through a bariatric program. Now we're talking
Wow.
about, this was a long time ago. This
Right.
was back in, well, I don't know if I want to tell you when I
Oh,
graduated.
you're gonna say your age, Dr.
I
Love?
don't think so. Let just people guess what my age is.
Uh-huh.
But I rotated through a bariatric program, and I was just so fascinated and in awe of people that had a weight problem, obesity as a disease, actually moving forward with a surgery to help them. And I was just so emotionally attached to that because I saw the bravery that the patients went through. Like, it's not easy. It's not easy being in that condition. It's not easy moving forward with surgery. And then with all the stigma and bias around it, you know? And I loved it because it really helped me utilize everything I learned in school as a biologist, as a lab tech. I understood how to read lab reports. I understood about diet. I understood about tube feeding. I understood about all that. So I'm like, wow, bariatrics takes all of that, right? Counseling, emotional, nutrition. So I'm like, yeah, I really like this. So that was one of my fields that I really, really enjoyed. So in dietetics, you can go into so many different fields, but that's the one that I liked the most.
Wow.
But then what happened was my life turned again.
Mm-hmm.
So when I graduated, I went into a little different direction. I went into education full time. So I did some counseling, did some part-time nutrition stuff, but I went into education full time. So I think that's what really honed my education background, because I was also an educator. That was my secondary degree.
Wow.
Then things happen because life never goes in a straight line. And the owner of the school that I was the director of education, he passed away. And again, it was very emotional for me, very emotional. Because as you know, I get very attached.
Yes. Yes.
So I had to leave. I couldn't stay there anymore.
Mm-hmm.
So I said, wow, what should I do? I'm going to go back into dietetics.
Wow.
So I looked in the paper, let's see what jobs are out there. And I saw that a facility was advertising for a diabetes center. So I said, okay, well, I'll counsel people with diabetes. I'll talk about that because I can do that with my degree. Because at this point, I still have my master's degree, right? So I applied, and I go to the interview, and the interviewer says, oh, no, it's not for the diabetic center. It's for the bariatric center.
Wow.
I'm like, the bariatric center? The ad said diabetes. They said, yeah, that was an error. It's actually the bariatric center. And I was so excited because that was my favorite rotation.
Right.
That's what I resonated with the closest and the best. So I interviewed, got the job.
Wow.
And that's how I really honed in on my bariatric skills. I got in early. You know, bariatric surgery has been performed since the 1950s, 60s. So when I was getting in, there were a lot of changes in bariatrics, bariatric surgery centers of excellence. There were different guidelines, so I was getting in kind of at the beginning, but in a better way, really. I met the most amazing surgeons, physicians, nurses, practitioners, amazing.
Wow.
So I just loved it so much, and I still do. So I decided, you know what? I want to get a doctorate.
Wow.
I didn't want to go on to medical school. I didn't want to be a PA or a nurse practitioner or anything like that. I wanted a doctorate. So I got a doctorate in health administration, and my dissertation is on interdisciplinary collaboration and perceptions of interdisciplinary collaboration of bariatric surgery centers of excellence.
Wow.
And what I looked at was, what were the perceptions of collaboration between the team members, the nurses, the physicians, the surgeons, the dietitians. And what I found through my research was that doctors and nurses have a very special relationship. right? Nurses and dietitians have a special relationship,
Right.
but dietitians and doctors don't have a special relationship. As a matter of fact, we don't really collaborate that much.
Right.
So that was the finding of my study. So right then and there, I said, no, I'm going to change that. I'm going to change
Wow.
that. I want to get closer. I want to get more involved with surgeons. I want to get more involved with the process. I want to understand the surgery. And one of my mentors had said to me, and I'll always remember it, he said to me, you know what? Everything that you do in this field needs to be for the betterment of your patient. And I really took that to heart. So I wasn't just a dietitian that saw patients for pre-op and post-op. That's great. I want to keep doing that because that's how I hone my skill as well.
Right.
And I meet so many amazing people. But I wanted to go bigger than that. I wanted to affect practice because I saw things in nutrition practice with metabolic and bariatric surgery that I didn't agree with. And I do have a nickname behind my back, which is
Uh-oh.
actually in front of my face now. They call me Buzzkill Lil.
Okay.
Now I'm taking it as a badge of honor, not something derogatory. I did in the beginning, and the reason why I had that reputation was I was a little bit of a bull in a china shop. If I didn't like something that was happening, I'd be, no, we can't do that, and this is why.
Right.
And I would be a bit of a loudmouth. I really would. I can tell you stories where I'd be presenting at conferences and presenting something to a room full of doctors and nurses and dietitians and people that have been in the field and say, no, patients are experiencing this. We need to do things better.
Wow.
And I remember there were several occasions where people were like, who is this person? She's just a troublemaker. She's this, she's that. But my purpose was, I'm listening to my patients. They're telling me stories. How are you telling me that this isn't true? Aren't you listening to your patients?
Right.
What can we do to make our patients' lives better
Right.
and sounder? You know, and I collaborate with a lot of different professionals. You know I'm not a psychologist. I know I'm not a surgeon. I know I'm not a nurse practitioner. We need everybody on the team. Everybody.
100%.
Because it is a patient-centered approach. Interdisciplinary collaboration. That's my research.
Right.
And it just wasn't happening. It was pseudo happening. It was happening on paper. It was happening in terms of accreditation because that's what hospitals needed. But it wasn't really happening in the real world. We were still working in our silos. We're still doing the same thing over and over again, even though we knew, is that really the best thing? People maybe thought it was.
Right.
So I started to get even more involved in different associations, different professional associations that, guide bariatrics. I've written some book chapters. I've published some papers. I do presentations. So I'm in the front, not in the back.
Yeah.
And if I see that something could be changed, why not? Why not?
not? Yeah.
Question things.
Mm-hmm.
I mean, one example that I can give is that when I was in practice in the early part of my career, because I've been in this for about 25 years now, a lot of people wanted the sleeve, but it wasn't covered by insurance. So a lot of people couldn't get it. And then eventually it started to get covered by insurance because of all the fabulous people that were fighting to get that done.
Right.
So once we started to get familiar with patients with the sleeve gastrectomy, I was noticing that patients were telling me that some of their symptoms when they ate or drank too much sugar or had too much fat, it was very similar to the gastric bypass. So I had a lot of experience with the bypass. They were saying, yeah, I'm getting kind of like a dumping a little bit. I get diarrhea, I feel weak. I'm thinking, oh, sleeves get dumping syndrome. And that wasn't in literature anywhere.
Wow.
But I observed it because of what my patients were telling me. So I decided to bring that out into the community, to the group and say, patients with the sleeve experience dumping syndrome. And it wasn't a belief back then.
Right.
It was like, yeah, you don't know what you're talking about. You don't know anatomy. You don't know this. You don't know that. Oh, no, I really do. I really
Right.
do because I'm listening to my patients. And maybe the mechanism is a little bit different, but the result is the same,
Wow.
right? These patients are getting sick.
Right.
So what do we do? Tell them that it doesn't happen when it can happen? How about educating them that it could possibly happen, right? So I don't know what I do now with my patients. I do get very close with my patients because I give them a lot of respect.
Right.
All right. Obesity is not just personal responsibility. And it's because, eat less, exercise more. You
Yep.
know, it's pathophysiological, it's chemical, it's hormonal, it's emotional, it's food, it's medications. It's just not one single thing. And that's what
100%.
makes it amazing, you know. Metabolic and bariatric surgery is not the be all end all. It's a tool.
You just have
It's,
to use
you
it.
know, exactly. But I felt a lot of people don't understand how to use the tool. So they get this tool, but nobody tells them how to navigate it. You know, to
Right.
me, it's like, you know, you get a brand new car, but it's a manual, and nobody's
Right.
told
How do you even
ha-
drive it?
you know, and I have to compare things to cars because
Yeah.
I love cars,
You love
right?
cars.
Especially sports cars. But, you know, if you stuck me in a manual shift, I wouldn't know what to do.
Right.
You know, it's a beautiful car. It's a great tool, but
Right.
I can't drive it, you know?